There are two main places of entry when you're admitted to Glasgow Royal Infirmary for a medical problem. If you come as an emergency by blue light ambulance, you're usually assessed in the emergency department. Or if you're reviewed by your GP and come to hospital for assessment, this is usually in our acute assessment unit. And depending on your needs, you may be discharged with or without services arranged in the community. If you're admitted to a ward for a medical problem, such as a chest infection, it's normally to the medical admissions unit here in the Jubilee building. If you need reviewed to another specialty, such as a heart problem or a broken bone, you'd be admitted under a different specialist elsewhere in the Royal. In the medical admissions unit, there's a specific area looked after by doctors called geriatricians, and this is the acute frailty unit. We specialise in the care of complex, frail older people and work very closely with other professions such as nurse specialists, physiotherapists, occupational therapists and dietitians, as research shows that frail older patients have better outcomes when cared for in this way. So, we want to start this as early as possible. You'll stay for up to 24 hours in the medical admissions unit before a decision is made either to discharge you home with or without support, transfer to another inpatient ward if you have ongoing clinical issues, or transfer you to intermediate care. This decision is made around your individual needs. If you're going home with support, this can either be in the form of home helps with community rehabilitation team, or sometimes for further help in a day hospital. If you're transferring to intermediate care, also called Step Up, this is a special unit in a care home with help from the community rehabilitation team, with a GP providing medical cover and input by a consultant geriatrician. Most people stay in the unit for up to 2 weeks. If you have complex medical issues and need to stay in hospital, you'll most likely be transferred to one of the geriatric medicine wards, which are all in the old building of Glasgow Royal Infirmary. Once you've recovered from your acute illness, you could be discharged home from the Royal, transferred for rehabilitation, or transferred to intermediate care. If you are transferred home, this is usually planned for at least a few days in advance. If you're back to your normal level of function, you'd be discharged with your previous level of care input. If, however, you need further rehabilitation, and this is at a level that can be done at home, you'll be discharged with the community rehabilitation team, and potentially a package of care provided by home helps. If you need inpatient rehabilitation, you'd be transferred to one of the rehabilitation wards. The rehabilitation team always include you and your family in setting realistic goals and plans that are important to you and those around you. This might be around improving your walking, working on your self-care, or working on your personal function. Before a discharge happens, the team will make sure that everything you need is in place to make it as successful and safe as possible. This might include equipment you need, organising home care or social work involvement, and any other services that are available to support you after discharge. If your care needs are too great to be discharged home, then you'd be assessed by the Health and Social Care Partnership team, that's social work and old money. This would be for intermediate care. The aim of this is to try to get you home. However, we have to recognise that some people can't be safely discharged home. This period of assessment usually lasts up to 4 weeks. If after you've been discharged and you still have ongoing medical needs, another option for rehabilitation is day hospital. You might visit once or twice a week for physiotherapy or other specialist treatment. And we'd also give you a home exercise programme for you to do independently at home. Our teams meet regularly to discuss your needs. It's important that we help you to feel ready and happy to be discharged.